Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. In this video, I'm going to be discussing and doing calculations of red blood cell indices. Okay, let's get started. Red blood cell indices are used to help to diagnose specific anemia types in patients. These indices are included in a complete blood count, or a CBC. So these are from whole blood specimens, usually from a lavender top tube, primarily on lavender tops, but they can be run on pink tops as well. So the laboratory professional runs these specimens on the CBC analyzer, and these indices are generated by that analyzer. So these tests are MCV, MCH, MCHC, and RDW. And I'm going to talk about each of these tests individually within this video, as well as perform the calculations that are used to generate these indices. But just in general, they are used to give the clinician a general idea of the patient's clinical picture and help to accurately predict the appearance of the patient's red blood cells when viewed in a microscopic blood cell differential. So before I get into each of these specific red blood cell indices, I wanted to show you this. So this is a result form of a complete blood count, or CBC, given by a Sysmex analyzer. So this is actually from one of my patients many years ago, and I saved that printout, with names redacted of course, for my students to look at. So again, this is run on a lavender top. It's a whole blood specimen. And in this case, it was run on a Sysmex CBC analyzer. Sysmex is a brand of this specific CBC analyzer. So, and these results are, of course, generated by that analyzer. So let me get my pointer out here. I'll use red. I feel like that's always my default on this. I'm not really sure why, but all right, so we'll use red here. So this is the first result. All right, and I'm just going to continue going down and describe all of these as I'm talking. This is the white blood cell count. So this result is 11.13 times 10 to the third power per microliter. Red blood cell count, this RBC, is 3.84 times 10 to the sixth power per microliter. And then we have the hemoglobin and hematocrit, which are these. So here's hemoglobin, here's hematocrit, okay? And those are 10.5 grams per deciliter and 32.5% for that hematocrit. And then we're seeing this MCV, MCH, and MCHC. So these are the red blood cell indices that this presentation is about. And then there's platelets, which are right here, all right? And you can see that result is 258 times 10 to the third power per microliter. Then you'll see RDW. So this is another red blood cell indice, and you'll notice here that there's RDW SD and RDW CV. All right, so this is standard deviation and coefficient of variation. So this is laboratory specific on which one is run or used. And for this particular laboratory, we only ran RDW-CVs. So I'll talk about that later on in this video. And then there's something called MPV, or mean platelet volume. In this particular patient's result is 9.1 femtoliters. So this is what the printout for a complete blood cell count looks like. All right, so the first red blood cell indice I'm going to talk about is mean cell volume, or MCV. And this is a calculation of the average of the volume of the red blood cells in the patient. So this is measured in femtoliters, or FL, and the normal reference range for a patient is 80 to 100 femtoliters. So the analyzer measures the patient's hematocrit level and red blood cell count and performs the calculation of hematocrit divided by the red blood cell count, and then multiplies that by 10 to calculate the patient's MCV. So what does this mean? So the MCV tells you the size of the red blood cells. So it tells you, are they normal sized? Are they smaller than normal? Are they larger than normal? So this is what the MCV is going to tell you. So for a normal MCV, which is again 80 to 100 femtoliters, this is going to be describing normally sized red blood cells, and we call that normocytic. So normocytic red blood cells have a normal MCV and they're normal size. For an MCV that is abnormally decreased, so less than 80 femtoliters, we call those red blood cells microcytic, and they will appear smaller than normal. Now, for an MCV that is abnormally increased, so above 100 femtoliters, we will call these red blood cells macrocytic, and they will appear larger than normal. So let's take a look and see what these red blood cells look like. So this is a peripheral blood smear of a patient with a normal MCV. So these red blood cells are normocytic, meaning that they are of normal size. So these look like very normal looking red blood cells on the right hand side of this slide here. So this is a normocytic red blood cell, normal MCV. Now this would be a peripheral blood smear of a patient with a decreased MCV. So these red blood cells are microcytic, meaning that they are of decreased size. So these arrows in this photo on the right hand side are showing microcytes. So actually these particular red blood cells are also hyperchromic, which we'll talk about a little bit later on in this video. But for the purpose of this slide, we are referring to the size of these red blood cells. So these are smaller than normal. Look how small that is in comparison to, let's say, this one, all right? Or this one, okay? This one is small as well. So this one, of course, is cut off, but that one is also a microcyte. So we're looking at the size of the red blood cell here. So this is a decrease. This patient would have a decreased MCV value. Now, this would be a peripheral blood smear of a patient with an increased MCV. So these red blood cells are macrocytic, meaning that they are of increased size. So look at some of these red blood cells here. They're abnormally large. So look at this one. It's bigger than a normal red blood cell. They're also kind of oval in shape. So this is a bigger one as well, compared to a normal size red blood cell, which would be here. Okay. So those are macrocytic, and this patient would have an increased MCV value. Okay, so now that we've talked about what MCV is and looked at the cells that have an increase in MCV, a decreased MCV, and a normal MCV, let's look at how to do the calculation, right? So what I've done for MCV is I've written the calculation here. It's hematocrit divided by red blood cell and multiply that by 10. So it's very easy, just a plug and chug thing here. So we're going to look at this particular patient. Their hematocrit is 32.5. So I'm going to use white for this because it's going to go with everything. 32.5. And then what are we going to do next? We're going to divide it by the red blood cell value. So the red blood cell value is 3.84. A lot of students ask me too, like, well, what about this, right? What do you do with that? Don't worry about that. Just put in this value, this 3.84, okay? So we're going to take that. So 32.5 divided by 3.84, plug that into the calculator. It's 8.46 is what I'm getting. And then we're going to multiply that by 10, okay? And that is, plugging into the calculator again, 84.63 is that MCV value. So again, what is the normal reference range for MCV? It's 80 to 100 femtoliters. So this would be a normal result, and we want to call that normocytic. So these red blood cells are going to be of normal size. All right. So the next red blood cell indice is mean corpuscular hemoglobin, or MCH. So this is the average weight of the hemoglobin that is present within the patient's red blood cells. It's calculated by taking the patient's hemoglobin level and dividing it by the patient's red blood cell level, and then taking that result and multiplying it by 10. So this MCH is measured in picograms, and the normal reference range for MCH in a patient is 26 to 34 picograms. Now this is directly linear to MCV, and what that means is, so if MCV is normal, so will the MCH. MCH will be normal. If MCV is decreased, MCH will be decreased. And of course, if MCV is increased, so will MCH. All right. So let's do a practice problem for MCH. All right, so this is going to be the same patient that we just did. And actually, as a matter of fact, this is that printout of that patient of mine years ago. This is actually their results. So we'll do a practice one here. So here again is the calculation. We're going to take the hemoglobin divided by red blood cells and multiply that by 10. So this patient's hemoglobin is 10.5. So we're going to put 10.5 here. And then we're going to divide it by the patient's red blood cells. So 3.84, all right? Again, don't worry about the times 10 to the 6th power. 3.84. Okay, plug that into your calculator. So 10.5 divided by 3.84. I'm getting 2.73 here. 2.73. And then we're going to multiply that answer by 10. Okay, and that gives you 27.34 picograms. Okay, and recall that the normal MCH is 26 to 34, and this patient has a normal MCH. And that makes sense because this is the same patient that we did the MCV calculation on, and remember, MCH is directly linear with MCV. So this patient has a normal MCV, so it makes sense that this patient also has a normal MCH. All right. Mean corpuscular hemoglobin concentration is a red blood cell indice that is abbreviated as MCHC. So this indice measures the average concentration of hemoglobin that is present in the patient's red blood cells. It's calculated by taking the patient's hemoglobin level and dividing it by their hematocrit level, and then multiplying that by 100. So this indice is measured in grams per deciliter, and the normal reference range for this is 32 to 36 grams per deciliter. Now recall that the MCV parameter describes the size of the red blood cell. Okay, so that's MCV. MCHC, of course, tells us the concentration of hemoglobin in the red blood cell, which is going to affect the central pallor of the red blood cell. And I'll explain this a little bit more on the next slide. So a normal red blood cell with a normal MCHC value is going to be something we call normochromic. A decreased MCHC, so an MCHC that is less than 32 grams per deciliter, those red blood cells are going to be called what we call hypochromic, right? And an increased MCHC, so over 36 grams per deciliter, the red blood cells in that patient are going to be called hyperchromic. And I'm going to explain this on the next couple of slides here, what hypochromic and hyperchromic cells look like. All right, so these are normal red blood cells that have a normal MCHC, and these are called normochromic red blood cells, all right? So when you hear chromic, it refers to MCHC. When you hear cytic, it refers to MCV, all right? So technically, these cells that we're seeing on the right-hand side, they're normal in size, they have a normal MCV, so they are normocytic, and they also have a normal MCHC. They have a small bit of central pallor, which I'll explain in a minute. So those are normochromic. So technically these are normocytic, normochromic. So these are, again, of course, normal red blood cells. And when I'm talking about central pallor, I'm talking about this lightening of color in the middle of the red blood cell. Okay, so this is what we call central pallor. And this is normal. So a normal red blood cell is going to have this much central pallor. See that kind of like whitening in the lightening of color? That's what we mean by central pallor. So these are normal, all right? Now, these are hypochromic red blood cells. So you can see here that these red blood cells have an increased area of central pallor, okay? So remember how small that central pallor was on those cells on that previous slide. This has an increased level of central pallor. You see how much bigger that area, that lightening or that white area is in these red blood cells in comparison to those normochromic red cells? You see how much bigger it is? Look at all of that, right? So this is an increased central pallor, and this is abnormal, okay? And this is referred to as hypochromasia or hypochromic red blood cells, and it is associated with a decreased MCHC. So if you see a decreased MCHC in the patient's CBC, their red blood cells are going to look like this, right? So that's hypochromic. Now, hyperchromic, all right, is an increased MCHC, all right? So if you notice with these arrowed cells, so this one here, and this one here, and honestly, even this one here, I mean, there's a little bit of central pallor here. They don't have central pallor, all right? So they are all uniformly the same red color, no central pallor in it. So this is an increased MCHC or hyperchromic red blood cell, or you could just say that the patient has hyperchromasia. So this is actually the same photo that I used to show for a decreased MCV. So these arrowed cells here are both hyperchromic and microcytic. So they have no central pallor and they are smaller in size than a normal red blood cell. So they're microcytic, hyperchromic. They are going to have a decreased MCV and an increased MCHC. Okay, so let's do an MCHC practice problem. And again, this is our same patient that we've been using for the MCV and the MCH. So we're going to take hemoglobin divided by hematocrit, and we're going to multiply that by 100. So this patient's hemoglobin is 10.5, so let's just plug and chug into this formula. I love when math is easy. These formulas I can do. I'm not a math person, but I like doing these calculations because they're pretty simple. All right, so hemoglobin divided by the patient's hematocrit. So we're going to take 32.5. So 10.5 divided by 32.5 is what? I'm getting 0.323. Okay, excellent. So we're not done yet. We're going to have to multiply that by 100. Okay, and that gives you 32.31, and we're doing MCHC, so it's going to be grams per deciliter. Boom. All right, so this is our answer, 32.31 grams per deciliter, and recall the normal reference range for MCHC, 32.31 is within that. Actually, it's on the lower side of normal, but it's still normal. The reference range is 32 to 36 grams per deciliter, and this patient is 32.31. So their MCV, this particular patient has a normal MCV, which we already did on a previous calculation, and a normal MCHC. So we would call those red blood cells normocytic, normochromic, right? Hopefully that helps you. All right, so the last thing we're going to be discussing in this presentation is the red cell distribution width, or RDW. And this is either a coefficient of variation, so that would be RDW-CV, or a standard deviation, which would be RDW-SD. So this is either a coefficient of variation or a standard deviation of the patient's MCV value. So this is something, again, that will be generated by the CBC analyzer. And what it shows is the degree of variation in red blood cells, right? So the normal reference range for this is 11 to 15%, right? And when the RDW is greater than 15%, it's what we call a nesocytosis. So lower than this reference range doesn't have a term for it. There's no clinical issue there. It's only when it's greater than normal, and this is a nesocytosis. So if you look at these cells on the right-hand side of this slide, this is a patient that has, honestly, a couple things going on, but you can see that there is definitely a variety of sizes here within this patient. So this is a microcyte, okay, and this is a macrocyte. This is definitely a macrocyte. And then there's some like normal looking cells. So I would say that one's pretty normal. This one's pretty normal, right? So there's a variety here. There's some that are little, and there's some that are normal, and then there's some that are larger, right? So there's just a variation in the size of the red blood cells, all right? So this is what we call a nesocytosis. Also, if you notice here, there is some other stuff going on. Hopefully you're looking at these cells and realizing that they're not normal. You see some of these have a very large increased central pallor, right? If you remember from this presentation, what is that called? Do you remember? It's called hypochromasia, okay? So likely this person is going to have an increased RDW because there's a variation in size, and there's a lot of hypochromic cells. So likely their MCHC is going to be decreased, right? So this is anisocytosis, and that is associated with this RDW. Now, you have already seen this. So this was the original patient that we've actually done the calculations on. And if you go back, you can see that our calculations were accurate. So we did the calculations right. The MCV, MCH, and MCHC are going to be the same here as in our calculations. But I wanted to bring this up here. So one of the things with red blood cell indices and students doing being new at doing blood cell differentials in my student lab, students tend to get really excited when we go over this lecture and they see on the actual manual cell differentials, they'll see like hypochromic cells, and they'll be like, oh yeah, Rebecca, I see hypochromasia. That's wonderful. I'm super glad that they're able to look at those red cells and see, like, identify, okay, these are hypochromic. Excellent, awesome, A+. But what's important to know as a student and also as a medical lab professional is you need to make sure that what you are seeing under the microscope in doing a blood cell differential matches up with these indices, okay? So if you are seeing microcytes, all right, it should show up here, okay, on this patient, right? And you don't want to call microcytes unless this MCV is decreased, okay? Same with macrocytes. You may say, oh my goodness, yes, macrocytes. Okay, awesome, I'm going to call it. You don't want to do that unless it correlates with the MCV. If the MCV is not elevated, you don't want to call it, okay? Same with MCHC. This is honestly the one that I get the most is people like, oh, hypochromasia. Awesome, super proud of you, good work, I'm really glad. But you have to know that it has to correlate. So if the MCHC is decreased, you don't want to call it, all right? Now, some laboratories have a specific designated measurement threshold, essentially, of when their medical lab professional should be calling things. So if I recall one time, one laboratory that I worked at, I just remember this offhand, is they did not want techs calling macrocytosis unless the MCV was greater than 110 femtoliters, okay? So I can't remember what the MCHC parameters were. It's been a while since I've worked actually in a lab, but I can't remember those specific parameters. But each lab is likely going to have specific parameters of when you call it and when you don't call it. So I want to make sure to include this in this presentation because that is something very important. You can definitely say, hey, I'm seeing this, but you definitely want to correlate it with the actual CBC results. So hopefully this helped you. So if this video helped you out, go ahead and give it a like. Feel free to leave any comments below in the comment section. I will gladly answer your questions. If you have any other ideas of what kind of videos that you want me to complete, please leave those in the comment section below. All right, until next time.